Welcome to our guide for Metabolic Parents Learning, where you will learn everything you need to know about PKU. This video has been created as a tool to enable learning for metabolic parents and has been developed by medical genomics students at the University of Toronto through advice and consultations from leading healthcare professionals. The story of PKU begins with diagnosis. Usually, this occurs when the clinician working with Newborn Screening Ontario reaches out to inform you about your newborn screening results. Newborn screening is a test we do in the first 24 to 48 hours of your child's life by a simple heel prick and filling up some circles on a piece of paper. This paper is then used to test your baby for at least 29 treatable genetic diseases. By genetic disease, we mean that this is a condition caused by changes in your child's DNA. These diseases usually show no symptoms in the first month of life. However, if not treated early, they can cause serious health problems. The main purpose of newborn screening is to let doctors diagnose babies with genetic diseases quickly and to start treatment as soon as possible. One of these genetic diseases which is diagnosed through newborn screening is PKU. But what is PKU? PKU stands for phenylketonuria. Phenylketonuria is a protein metabolic disorder where the body has a hard time breaking down protein found in many of our foods, affecting healthy growth and development. Proteins are made up of small subunits called amino acids. Our body, with the help of enzymes, transforms amino acids to other substances or energy. A number of different enzymes are needed to process these amino acids for use. You can think of enzymes as a set of scissors, which cut and shape certain amino acids into other substances. People missing these scissors cannot process certain amino acids. This amino acid buildup causes disorders which lead to toxicity and health problems. But how does any of this relate to PKU? Well, in PKU, the body cannot process one of these amino acids, which is phenylalanine, also known as Phe. In our body, we normally use an enzyme called phenylalanine hydroxylase or PAH to convert phenylalanine into tyrosine. For PAH to work, it needs a special substance called BH4. Once phenylalanine is converted to tyrosine, tyrosine then gets converted into neurotransmitters, which are small molecules important for healthy brain development and function. When a person has PKU, there is not enough PAH enzyme. It is either missing or not working properly, just like this machine breaking down. This results in not enough tyrosine and too much phenylalanine buildup. Now, before moving on, pause the video here and think for a moment. What do you think is the effect of having too much phenylalanine in the body? Okay. Now that you have had time to think about this, let's discuss how this will affect the body. In PKU, high levels of phenylalanine and low levels of tyrosine can change the way the brain functions. This happens because phenylalanine uses the same molecular transporters to cross the blood-brain barrier as other amino acids. To understand this better, let's think of this transporter as an elevator bringing amino acids in the body to and from the brain. When phenylalanine levels are too high in PKU, it's as if phenylalanine occupies all the space in the elevator, not allowing for other amino acids such as tyrosine to get in. Since tyrosine and other important amino acids can't get into the elevator, they are stuck in the lobby and phenylalanine takes over the brain, causing abnormal brain development if left untreated. Now let's discuss what the imbalance in phenylalanine and tyrosine levels will look like in a child with PKU. Newborns with PKU initially do not have any symptoms. However, without treatment, Babies usually develop signs of PKU within a few months. Signs and symptoms of untreated PKU can be mild or severe and may include brain damage affecting development and learning ability, behavioral, emotional, and social problems, skin rashes, and they also have a unique musty odor in their breath, skin, or urine, caused by too much phenylalanine in the body. However, with proper management of the phenylalanine buildup, normal growth and development is possible for your child, and these symptoms can be avoided. Now, you must be wondering, what causes PKU? PKU is a genetic condition. It is important to understand there is nothing you did or did not do to cause your child to have PKU. There is nothing you could have taken, and nothing you were specifically exposed to before, during, or after your pregnancy that caused your child to have PKU. It just happened by chance. To understand this better, let's look into our genetic material found inside our cells. Our DNA is packaged into thread-like structures called chromosomes. Spread on chromosomes are our genes. Genes are made up of DNA. Genes carry instruction to make enzymes. Enzymes have specific jobs that help our body work normally. Genes and the enzymes which they make must function properly in order for us to be healthy. In a typical person, if the gene is working properly, it will code for specific enzymes. Enzymes then in turn perform a specific function, such as converting A to B. In PKU, spelling changes in the gene create a PAH enzyme that doesn't work properly. This means the enzyme has trouble converting phenylalanine to tyrosine, causing level of phenylalanine to increase and level of tyrosine to decrease. Now let's discuss the treatment options available for a child with PKU. The goal of PKU treatment is to maintain phenylalanine levels between 120 and 360 throughout the affected individual's lifespan. As discussed earlier, persistent and prolonged high levels of phenylalanine can lead to learning and behavioral difficulties for your child. The main treatment for patients with PKU is a PKU diet. Phenylalanine is present in foods that we eat which contain protein. Individuals with PKU must be on a special diet, which limits the amount of protein-rich food to decrease phenylalanine intake. In this case, what should your child avoid eating? You can still breastfeed your child. However, always remember that your child can only tolerate a small amount of breast milk at a time. This is called restricted breastfeeding. Your dietitian will help you determine how much breast milk your child can tolerate. Once your child starts to consume solid foods, they must avoid or strictly limit intake of milk and all dairy products, such as cheese, yogurt, and ice cream. They must also avoid or strictly limit red meat and poultry, fish and seafoods, eggs, nuts and nut butters, beans, ordinary flours, and nutritional formulas not specifically made for children with PKU. In addition, it is very important that your child avoids the sugar substitute aspartame, which is sold under various names. Aspartame contains high amounts of phenylalanine. It can be found in packaged snacks, drinks, and even some medicines and vitamins. Aspartame can quickly raise the blood phenylalanine level in people with PKU. This is why you must avoid foods containing this substance. If you are not sure, always ask your pharmacist, metabolic doctor, or dietitian whether a food item is safe to consume for your child or not. Now, let's talk about what your child can eat. Many vegetables and fruits have small amounts of phenylalanine and can be eaten in carefully measured amounts. We understand a phenylalanine dietary plan is difficult to maintain. To help with this, there are foods specially made for people with PKU, such as low phenylalanine flours, baking mixes, breads, and pastas. You can find these special food items at specialty food shop, It is important to note that because of the restricted diet, your child will not get enough essential nutrients from food. So, they must drink medical formula to supplement these nutrients. Medical formula is a synthetic phenylalanine-free formula that gives children with PKU the nutrients and protein they require, while also balancing their phenylalanine levels within a safe range. Phenylalanine-free medical formulas are available for all age groups, and your metabolic doctor or dietitian will help you determine which formula is best for your child. It is important to follow phenylalanine-low diet throughout life. Adults who do not stay on this diet may notice some of the following symptoms: trouble paying attention and irritability, problems making good decisions, slow thinking, eczema, bone loss, and tremors. Each individual child is different. You will need to customize the amount of phenylalanine intake for your child with their metabolic dietitian. Apart from diet, there are 2 FDA-approved pharmaceutical treatments available for patients with PKU. Kuvan is the pharmaceutical drug version of the vitamin BH4. It works in the same way as the natural BH4 found in your body. Let's pause for a moment here and test your memory. Based on what we talked about regarding BH4, do you agree that children with PKU have low amounts of BH4 in their body? Children with PKU have normal amounts of BH4 in their body. In PKU, the only thing that is changing is the levels of pH decreasing. This means that this statement is false. You might be asking yourself, if BH4 levels stay the same, then why would we give Kuvan as a treatment for PKU? Our goal with Kuvan is to increase the natural levels of BH4 found in the body in the effort to increase the activity level of the underactive pH enzyme. This causes increased processing of phenylalanine and reducing phenylalanine level. Children on this treatment are able to tolerate higher levels of phenylalanine in food compared to other PKU children who are not taking Kuvan. 2 important things to know about Kuvan treatment. Kuvan must be used in conjunction with phenylalanine-restricted diet. One more thing to be aware of is that Kuvan does not work for everyone. This treatment is helpful in reducing blood phenylalanine levels in some children, but not all children with PKU. To find out if this treatment will work for your child, please ask your doctor to do the appropriate tests to know whether your child should take Kuvan. The other pharmaceutical drug treatment available for children with PKU is Palynziq. This is an enzyme which comes from bacteria and can be used to break down phenylalanine in humans and stop phenylalanine buildup. Keep in mind that this treatment is not approved to use for children below 16, so it is only an option in the future for your child. Now, let's get into how do you monitor PKU. Someone with PKU will usually need to have regular blood tests throughout their life. This blood sample can be collected at home and sent to the hospital by post. The blood test is done to measure phenylalanine blood level. If there is too much or too little phenylalanine in the blood, the diet may need to be adjusted to control these levels and prevent any serious health problems. Children with PKU will be followed closely and have regular clinic checkups. So as a parent, what can you expect at these checkups? At the clinic visit, your child's height and weight will be measured. There will be an assessment of your child's development. Also at these visits, the doctor will order blood tests to check amino acids and nutrients levels. Your child's diet will then be adjusted according to the growth, development, and blood test results. Now, despite taking all the precautions, your child is like any other child and will sometimes get sick. So let's talk about what to do when your child gets sick. During any illness, our bodies need extra energy. So for babies with PKU, to get that extra energy when sick, they will start breaking down the protein inside their body into amino acids. This will cause phenylalanine levels to increase in their bloodstream. When your child is sick, it is important to continue with their PKU diet as much as possible and to ensure that your child is getting enough calorie intake. In addition, giving your child metabolic formulas can help keep blood phenylalanine levels down by providing phenylalanine-free protein and energy. Now you might be wondering, how did your child get PKU? And what is the chance that your next baby will have PKU as well? PKU is a condition that passed on through an autosomal recessive inheritance pattern. You might be wondering what this means. Let's break it down together. Everyone has 2 copies from every gene. One is taken from each parent. In autosomal recessive inheritance, an individual will need to get 2 non-working copies of the gene, one from each parent to have PKU. For someone who has 1 working copy of the PAH gene and 1 non-working copy of the PAH gene is known as a carrier. Carrier does not have PKU, as the remaining working copy will still allow the PAH enzyme to be made and function normally. However, a carrier can pass on 1 non-working copy of the PAH gene to their children. If both parents are carriers, there is a 25% chance for each child to get PKU. Let's pause a little bit here and test your knowledge. Given what we learned earlier, what do you think is the chance that 2 parents who are carriers of PKU will have a child with 2 healthy copies of the gene? Pause the video here. Work it out on your own for a minute, and we will walk you through the answer when you come back. Now let's see if you got the answer right. If both parents are carriers, there is also 25% chance that each parent will pass 1 working copy of the PAH gene for their child. Then the child will not have PKU and will not be a carrier for PKU. There is a 50% chance for each child to be a carrier for PKU as their parents. These chances are the same for each pregnancy, whether you are pregnant with a boy or a girl. If someone who has PKU or a carrier has children, the chance that each child will have PKU depends on whether the other parent is a carrier or not. Talk to your doctor to know which members of your family is at higher risk of getting PKU. Let's go over a quick recap of what we have learned so far. In PKU, phenylalanine levels are increased in the body, while tyrosine levels are decreased. If not treated properly, symptoms like developmental delay, behavioral and emotional problems, and intellectual disabilities can arise. Testing for PKU is routinely done through newborn screening, which allow for early identification and early implementation of treatment. The first-line treatment for children with PKU is a low phenylalanine diet throughout life, along with a medical formula which helps to compensate for nutrients and protein missing in your child's low phenylalanine diet. This will also help to keep phenylalanine levels within a safe range in the body. There are 2 FDA-approved drugs available for PKU, Kuvan and Palynziq. Remember to always check with your child's doctor before administering any drug. Always remember that when PKU is correctly managed, your child can enjoy normal growth and development. This brings us to the end of our webinar. Thank you so much for watching. We hope this video helped you to get a better understanding of your child's condition. To learn more about PKU and how you can support your child, visit medicalfood.com.